So the question we're covering today is extremely important. You wrote an entire book about this, and basically it's what a patient should know, all the important facts a patient should put in their head before making a treatment decision when they were just diagnosed with prostate cancer.
Well, you're right. There's an endless amount of stuff we could cover, but I suppose number one is that you have to fend for yourself. The industry is kind of like a big machine, and it has its own ideas on what it wants for you. And the only way to combat that is to educate yourself, learn your grade, find out what a high or low PSA means, decide what your priorities are. A lot of the treatments for newly diagnosed men can affect sexual function, but if someone's 80 years old, it may not be that big a deal. So knowing what your goals are, and then not to be bashful about questioning your experts is a really important principle. The doctors that are doing this are doing it every day. They're very practiced. They're very smooth. They have their, as I said before, their ideas. And it's necessary to have your own ideas and to make sure that you understand what's going on rather than just deferring to whatever plan is already in place. It's logical, of course. If you're seeing a surgeon, they're going to tend to want to do surgery. Or if you're seeing a radiation doctor, they're going to want to tend to do radiation. And there are reasons to do one or the other. And if the patients don't know those things and embark upon an objective discussion, maybe get second opinions, bring friends with them to their consultations so that they have 2 or 3 people listening. This is a complex world, and it's really important for people to be very systematic and think through what they're doing.
Everything you just said is extremely important. I know that many of my friends have read your book and paid attention to those facts when they were making their treatment decisions, and it definitely benefited them. I think if you want more information about what Dr. Scholz just spoke about, you can go ahead and visit our website at PCRI.org, and you can go to the tab that says Start Here, and under that says The Basics. And when you click on that, everything that he just spoke about, it's talked about in detail, so that may be helpful for you. Thank you so much for watching. If you appreciated this video, go ahead and subscribe to our channel and hit the like button. This helps share this video across the YouTube platform for other prostate cancer patients. And if you have a question that you would like asked in the future, you can go ahead and leave it in the comment section below. For further questions or any information you need, you can visit us at PCRI.org.